right, so welcome back to another episode where I'm talking about, working in the US here as a Jamaican nurse. So if you haven't watched my initial video, please go ahead and watch that episode, and then you can watch this one as a follow-up. But either way, if you're here already and don't want to watch the other one, thank you so much. Just go ahead and continue watching. All right, so as I said in my previous video, I worked in Jamaica as a nurse for about 4 years, and then I transitioned to the US and continue working in the nursing industry. And so I have gathered like a lot of experience. I am happy, about my experience working in Jamaica, because you experience so many things. You see a lot of things on a daily basis that you are able to actively participate in. And so I am going to talk about working in the US here as a nurse, as a Jamaican nurse, and my experience with that. For now, if you haven't subscribed to the channel, my name is Stacy, and now I'm going to have you please go ahead, like, share, subscribe to the channel, turn that notification bell on. If you knew someone who is like interested in nursing field and is having doubts about it, somebody who is an international nurse wanting to come here to the US, then this is a channel for you. Or if you just want to hear nursing stories, this is a channel for you to be on. And so today I want you to go ahead and hit that like button, hit that comment button, ask a question, turn that notification bell on, and remember to subscribe the channel to come and hear, information related to nursing from a Jamaican perspective, living and working in the US. Because of short staff and probably the resources not available, such as having respiratory therapists, you might not have a wound care nurse, at hand. You find yourself having to do everything from suturing, minor sutures, to, assisting with intubation or assisting with, other procedures. Those are things that you get done. You do your nebulization treatment, you do your tracheostomy cleaning. So you do a bunch of different things that you were trained to do. And especially if you're trained as a certified emergency room nurse, then your scope is just a little bit bigger. So you're able to attempt certain things under the supervision of your providers. Here in the US, when you get here, depending on what skills you have obtained years ago during your nursing program or during your nursing career prior to transition here in the US, you will probably end up losing them. But the good thing about it is that they always say, if you earn a skill, if you've learned a skill, once you learn that skill, you can never lose it. So even if years from now you're not doing suctioning, you're not doing tracheostomy care, you're not doing wound care, years from now, you still should be able to do it, because you would have learned it well during nursing school, or you'd have learned it well during the time when you're doing your training, or during the time when you're in your country practicing as a nurse. Because when I got here, I would have had experience doing sutures. I would have known how to, do dressings, wound care. I would know how to do suctioning, tracheostomy care, nebulization therapy, and all of those things. But once you get here, because you have your respiratory therapist, you have a wound care nurse, you have other specialty available at hand, they will go ahead and do consults with those departments, and then have those technicians come in and see the patient. So your duty as a nurse kind of reduced to, assessment, discharge, triage, medication administration. And you'll go ahead and find yourself doing your wound care and everything else that you practice. But sometimes, if you go to your way and try to do the nebulization therapy on a patient, because, probably respiratory therapist is busy, sometimes they can get upset with you. Because you're administering something you're not supposed to be administering, because it's outside of your scope. But sometimes you have to go ahead and do it, because if they're tied up and you have a respiratory distress patient who is wheezing like crazy, what are you going to be doing? Sitting and waiting until, the respiratory therapist is finished doing 2 intubations to actually come and see your patient? What is going to happen with your patient is that your patient is going to be like decompensated. Your patient is going to be so distressed that there's a possibility that they probably end up intubating or admitting that patient because of the severity of their wheeze or their distress. So you just have to be critical as you go along, knowing the what to do and the don'ts of your department. So when you get here, it might just be a little bit different, because as I say, you lose a lot of your skills if you haven't, so for example, you come over here and you're working and you're not practicing some things, then you will eventually lose your skills. But the good thing about it is that if you've had the skill done before and you know how to do it and you can go to your bed, close your eyes and just memorize how to do it, then there's a high possibility if years from now, that same skill pops up, there's a high possibility that you will do well. So here, that's just one of the biggest problem I notice. Another thing is that, when the EMS, sometimes the EMS they don't really call report, and so the patients will pop in, and nothing is wrong with that, because as an emergency room nurse, you're trained to be, on the lookout, anticipating whatever it is. And for me, a Jamaican nurse, knowing that we don't have around the clock EMS services, bringing patients to us and dropping them off. We get the patient as is on the field. So if it means that one of them has like a degloving injury, we know how to deal with that once they present to the emergency room by a passerby or a good Samaritan. We know what to do because our energy level is up, our adrenaline is up to care for those patients. So we don't necessarily have to be dependent on EMS to go ahead and put in an IV, to go ahead and start a pressure dressing or put on a tourniquet on a wound that needs to be, applied pressure. So it's a case where you are here, but because of your experience in your country and because of the lack of resources that you've experienced, you are on top of things, being proactive in terms of getting things done. And so that is a plus for you as an international nurse who have experience working in a department that is lacking resources, lacking staff, equipment, supplies, whatever it is that is not available to do your work. You realize that once you're here, you are going to be the best nurse you can be because you have additional resources, and plus you have the skills and the knowledge, the critical thinking skills is just there. And so you will do well in your department. All right. Another thing is that, because you're accustomed to documenting as well, that's another thing that you will find yourself doing. A lot of nurses here, I realize they don't do much documentation, but I want to say follow the hype and do that. Find the time to go ahead and document. As I said in my previous video, how hard you study to go ahead and get your license. You know how hard it was to go ahead and get your bachelor's of science in nursing. You know the struggles you went through. You know the struggles your family members went through to get you that education. So don't take it lightly that, because one person get away with it, you're gonna be getting away with it. No, and that's how it go. Especially when you know what you know, and that's how it go. You understand? So don't do as what everybody else is doing. Don't follow the crowd. Make your mark, stand out, and make the perfect notes that you normally would do in your country to protect yourself and protect your license. All right, because as they always say, documentation is key. Work not documented is work not done. So go ahead and make sure you're documenting as you go along. Another thing is that you hardly can find time to take breaks, and I said that in my other video, but still remember, try to find the time and prioritize, taking breaks, because that's one way you're going to help with preventing burnout in the future. You don't want it to be a case where you're just working constantly and not being able to find that time to build up on your energy level. You don't want it to be a case where you're not finding the time to say, I need to go ahead and step aside from this chaotic environment. I need to take the time out and go and stand over that side and breathe, drink a little bit of water, go to the bathroom and make sure your bladder is fine, because it doesn't make sense you're running around this department, caring for everybody else, and you're over there developing urinary tract infection because you can't find the time to go to the bathroom. It's not worth it. It's not worth it. Find the time for self-care. Find your time. Find your space to go and take that 5 to 10 minutes to ensure that you're looking after yourself. You're being the best person, to take care of those patients that are coming to you on a daily basis to care for them. All right. Another thing is that you'll find is you'll have issues with probably trying to get reports to the floor. And that was just one thing that I currently struggle with at my current facility, because sometimes you might get a bed that is assigned to your patients in the emergency room for probably 30 minutes. And I don't know if I'm just being, not realistic or what, but it can take, you get a bed now and say it's 12 o'clock. You just get a bed. You give the floor 30 minutes to take report. At that time, they still don't know who is taking report. The charge nurse is on break or the nurse is on break for 30 minutes. They're telling you, oh, go ahead and call back in 45 minutes. And then by the time you call back in that time period. So remember now, it's almost 45 minutes now that the patient is still in your department with a bed assigned, but nobody is on the inpatient side wanting to take report. And then by the time you finally get through to somebody, the nurse is busy in a room doing something else, and then they want you to call them back in 5-10 minutes. And by the time you call them back in 5-10 minutes, That's 1 hour we're looking at. By the time they take report, they're still asking you all the questions that they're going through on the chart. They've already reviewed the chart and they're still asking you all the questions again for the next 20 minutes on a patient that has nothing big going on. And then by the time you look, it's another 30 minutes or 40 minutes before they come and pick up the patient. So you realize you're hanging out with these patients in the department for long hours after they're being assigned a bed. You understand? And it's like you're trying to get the transition of care going, but it's hard. And so persons might find it difficult. They might find it difficult understanding your point of view, especially if you're trained in a hospital or if you're trained in an environment where there is always constant emergencies going on. So you're always trying to be proactive, wanting to ensure that your department is clear, because you know that when you were in Jamaica, you know that sometimes you can have one busload with patients popping in. And when you talk about patients coming in, you're talking about head trauma, you're talking about degloving injury, you're talking about regular altered patients, you're talking about a bunch of emergencies coming in. And because you don't have the space, you don't have the staffing to do that, you have to ensure that you are making that department clear and ready for whatever patients coming in. And so when you get over here and you're having this long delay in patients being transitioned to the floor, it can become a little bit frustrating. And then what you realize is that persons end up don't liking you because they say you call them too much to give report. And I can't really understand what it means by you're calling them too much to give report when really and truly the patient has had a bed for 2 hours. You don't need to be spending so long trying to give report on a patient for them to come and pick up a patient to take to the inpatient setting. So that is just like delaying care. The patient is not getting the care they need. And so you'll have your department being packed with other patients, who really needs to go inpatient. And then you have your emergencies that are popping in, not being able to get a room because those patients are assigned a bed for 2-3 hours, are still on your emergency room bed. Nobody coming to pick them up. Talk about, following the chain of command and talking to your supervisors. Sometimes there's always delay in it. And so that is just one frustration probably you will encounter at your facility. I'm not so sure. If you don't, then that's a plus. But if you do, I'm sorry, it's just something that you have to just kind of get used to. But as I say, it is something that comes with, being an international nurse and understanding that lack of resources, and what your emergency room usually looks like. That kind of behavior or that kind of pattern will kind of come with you in terms of trying to ensure that you're making a safe environment in your emergency room here, trying to make sure that, whatever is coming in, you are ready to take care of those patients. And so sometimes that's a problem that you will find, you will encounter. And until then, God bless your soul with dealing with all of the challenges that will come with it. But nevertheless, regardless of that as being one of the biggest challenge I face here, just remember the money is good. And there is so many opportunities out there that you can actually take up. So if you're having issues with this hospital, you can always jump board and go over to another hospitals, because there's so many health systems, so many different health systems available in one little area. You have urgent care, you have freestanding, you have hospitals, plus you have doctor's office. So there are so many options for you to go and do work. You have home health services that you can also sign up with and do. So depending on what you're looking for, there is a niche out there. There is an area that you can actually go into and find work to do that you might be comfortable doing. And we discussed the clock in and clock out already. So as I say, you always have to clock in for everything and clock out for everything, just to make sure you're accountable for your actions and your work. But otherwise, if you have a good work ethic, stick to it. Try not to let people tell you that your work ethic is poor, or especially if you've been working for years and yes, you probably sound strong, or after a while, who works in the emergency room and doesn't have a strong personality? You hardly find persons working in the emergency room not having a strong personality, because remember, as I say, you are on the front line. You are the face of the hospital. You're meeting all the stressful patients. You are meeting all the clients who are going through the hardest time in their health journey. So you're dealing with death. You're dealing with patients that are undergoing like life-threatening issues. You're dealing with their family members. You're dealing with patients who are going through, illnesses that has no cure. you're going to have to talk to them. And so, a strong personality in the emergency room eventually develop. And as long as you're advocating for your patient, as long as you're being professional and you're advocating for your patient, nothing is wrong with that. But at the same time, you just have to understand that everywhere the culture is different. And even if you have a strong personality, you're advocating for your patient, you can be on the wrong side. So, just be mindful as to how you probably go about saying things. You have to probably just put on a little smile and say, yeah, yes, that's how it is. Or, try to be fake sometimes in order to get the best response, or, for people to actually like you, because that's how you're going to actually get through, because nobody will understand where you're coming from. They don't understand your journey, your experience. And as such, as I say, you might be here doing things and you think you're doing the right thing, but really and truly, they probably see it as something totally different and might not be happy about it. And then they can actually do things to, pull the socks up a little bit. Yes, so just be mindful about that, but as I say, just come, give it your best shot, try to be flexible, remember time management is key, and remember, protect your license at all costs. If you realize you're in a situation where it's unsafe, speak up, speak out. And if you realize nothing is becoming of that, then, probably you need to step out of that playing field and find a playing field that is going to protect you as a nurse, as well as protecting you and your license as you go along. Because as I say, it's hard for you. It's hard because you work so much. You spend so much time in school, and then now to make one silly mistake cause you to lose your license. It's not worth it. But until then, as I say, this is just the experience I've had so far in the US working as a nurse in the emergency room. If your experience is a little bit different, or if it's the same, go ahead and share your comments below so we can actually help others, so that they can actually, try not to get into a situation where they're having issues with their license, they're having issues with their department or their hospital. So this is just a way for us to encourage others. Thank you for tuning in, and as usual, if you haven't subscribed, now is the time to go ahead and hit that subscribe button for more. Thank you for tuning in as usual, and I do hope that you will have a wonderful day. Bye.